Why bad breath is worse than you think. Imagine you're in the middle of an important meeting or a close conversation, and suddenly you notice people stepping back or avoiding eye contact. You may not even realize it, but your breath could be the culprit. Bad breath, or halitosis, affects more people than you'd expect, with about 1 in 2 adults experiencing it at some point in their lives. What's even more surprising, many people don't realize the severity of this issue, thinking it's just a momentary inconvenience solved by gum or mouthwash. But what if I told you bad breath could be a red flag for something much more serious? Have you ever been embarrassed by your breath? If so, you're not alone. And it's time to look deeper into what your breath is really trying to tell you. Bad breath has long been considered a minor social issue, something that can be quickly brushed off, pun intended. However, what many don't realize is that halitosis can be a sign of underlying health problems, some of which are far more concerning than just a little embarrassment. So, while you may reach for mints or gum to mask the problem, it's crucial to understand what's really causing that bad breath, and why ignoring it could have serious consequences for your health. The causes of bad breath. It's more than just oral hygiene. While it's tempting to think bad breath is solely a result of not brushing enough, the truth is far more complex. Several factors can contribute to halitosis, many of which can point to broader health concerns. Let's break down the most common causes. 1. Poor oral hygiene. It's easy to think that simply brushing your teeth twice a day is enough to prevent bad breath, but there's more to oral hygiene than that. Failing to clean in between your teeth by flossing allows food particles to get trapped, becoming a breeding ground for bacteria. These bacteria release sulfur compounds which are responsible for that unpleasant odor. In addition to bacteria, plaque buildup can contribute to gum disease, which not only leads to bad breath, but can also have more serious health implications. If you're not regularly visiting the dentist for professional cleanings, plaque and tartar buildup may be silently contributing to persistent bad breath. 2. Diet choices. You are what you eat, and what you eat can significantly impact your breath. Foods like garlic, onions, and spices contain volatile compounds that are absorbed into your bloodstream and released when you exhale. But it's not just pungent foods that cause problems. Diets high in sugar or processed foods can also feed the bacteria in your mouth, leading to bad breath. Moreover, low-carb diets like keto can produce a type of bad breath known as keto breath due to the production of ketones in the body. And let's not forget the role of alcohol and coffee, both of which can dry out your mouth and exacerbate halitosis. 3. Dry mouth, xerostomia. Dry mouth, medically referred to as xerostomia, is another major contributor to bad breath. Your saliva plays a critical role in washing away food particles and neutralizing acids produced by bacteria. When your mouth doesn't produce enough saliva, bacteria can flourish, leading to the production of sulfur compounds that cause bad breath. This condition can be caused by medications like antihistamines, decongestants, or blood pressure meds, which reduce saliva production. Dry mouth can also occur if you breathe through your mouth while sleeping, which is why many people wake up with morning breath. Chronic dry mouth should not be overlooked, as it can also lead to dental issues like tooth decay and gum disease. 4. Medical conditions. Bad breath isn't just an oral issue. It can be a sign that something more serious is going on in your body. For example, digestive disorders such as GERD, gastroesophageal reflux disease, can cause stomach acids to flow back into the throat, leading to a sour or bitter smell. Similarly, sinus infections can result in mucus buildup, which harbors bacteria that lead to halitosis. Other underlying health conditions like diabetes can produce a fruity odor in your breath due to elevated ketone levels, while liver or kidney disease can result in a more foul, fishy odor. These conditions make it clear that bad breath can sometimes serve as an early warning sign of larger health issues that require attention. Prevention. How to take control of your breath. Fortunately, there are several ways to tackle bad breath and keep it from becoming an ongoing issue. While improving your oral hygiene is a great start, it's also essential to address other lifestyle factors to ensure your breath stays fresh. Here are some key strategies to prevent bad breath today. Brush and floss regularly. Brushing at least twice a day and flossing daily are non-negotiables when it comes to preventing bad breath. But it's not just about your teeth. Don't forget to brush your tongue or use a tongue scraper to remove bacteria that linger there. Your tongue can harbor food particles and dead cells, which contribute to bad breath if left uncleaned. Try switching to an electric toothbrush. As studies suggest, they are more effective in reducing plaque and bacteria compared to manual brushing. Stay hydrated. Drinking plenty of water throughout the day is essential to keeping your mouth moist and maintaining saliva flow. Staying hydrated not only washes away food particles, but also prevents the dry environment in which bacteria thrive. Sipping water throughout the day, especially after meals, can help cleanse your mouth naturally. For those who struggle with dry mouth, sugar-free gum or mints containing xylitol can stimulate saliva production, providing relief and helping to prevent bad breath. Watch your diet. Limiting foods that cause bad breath, like garlic and onions, is a great first step, but you can also incorporate foods that naturally clean your teeth. Crunchy fruits and vegetables like apples, celery, and carrots act as natural scrubbing agents that help remove food particles and plaque. Additionally, eating foods high in probiotics, such as yogurt, can help balance the bacteria in your gut and mouth, contributing to fresher breath. Reducing your intake of sugary snacks and beverages is also crucial, as sugar feeds the bacteria responsible for bad breath. Visit your dentist. Regular dental checkups can help catch any oral health issues like gum disease or tooth decay that may be causing bad breath. Your dentist can also provide deep cleanings that remove plaque and tartar, which contribute to halitosis. Dental professionals can identify early signs of problems that may go unnoticed, such as cavities or infections that could lead to bad breath. Make sure you're scheduling a visit every 6 months to stay on top of your oral health. Address any medical issues. If you suspect that your bad breath might be caused by an underlying health condition, it's important to consult with your healthcare provider. Identifying and treating conditions like GERD, sinus infections, or diabetes can not only improve your overall health, but also resolve persistent bad breath. Ignoring these symptoms could allow the underlying issue to worsen, so it's important to address them early on. Don't be afraid to seek medical advice if your bad breath persists despite good oral hygiene. The surprising link between bad breath and serious health problems. Now, here's something most people don't realize. Bad breath could be a sign of serious health issues. One of the most alarming connections is between bad breath and gum disease or periodontitis. Left untreated, gum disease can lead to heart disease, stroke, and other cardiovascular conditions due to the bacteria entering the bloodstream through inflamed gums. Once in your bloodstream, these bacteria can cause inflammation elsewhere in your body, contributing to serious health complications. In addition, there is a well-documented link between bad breath and diabetes. Diabetics with uncontrolled blood sugar often experience a fruity odor in their breath, which is a sign of high ketone levels. Similarly, those with liver or kidney disease may emit a foul or fishy odor due to their body's inability to filter out toxins properly. In both cases, halitosis can serve as an early warning system for life-threatening conditions. Why you should take bad breath seriously. As we've discussed, bad breath isn't just an embarrassing inconvenience, it's a sign that something deeper might be going on. Whether it's poor oral hygiene, an issue with your diet, or a more serious medical condition, addressing bad breath should be a priority. By improving your oral care routine, paying attention to your diet, staying hydrated, and visiting both your dentist and healthcare provider regularly, you can ensure that your breath remains fresh and your health stays intact. Have you ever dealt with bad breath? What tips or remedies have worked for you? Let us know in the comments below, and be sure to check out our other videos on oral hygiene and overall health. Until the next one, stay informed, stay active, and most importantly, stay healthy.